hope that that's okay with everyone. We'll also be able to share a transcript afterwards. So if you did want to catch up on any of the notes or action points, we'll share those with everyone and those who aren't able to join us this afternoon too. And please do stay on mute. We will have time for discussion, hopefully, after the partners have spoken and then after THET introduces the campaign more broadly. But please do use the chat box throughout. We'll do our best to keep on top of the questions. So we might not be able to answer all of them live, but we'll do our best to keep monitoring that and answering those as we go along. And there will be polls and different bits and pieces for you to get involved with later on. So hopefully you'll take advantage of those and let us know your thoughts and feelings as we go through the hour. So to circle back a little bit, we can go on with the show now, which is really exciting. It's taken us a long time to get to this space, and I think it's no understatement to say that the last 18 months have been tough for us all, for our global community. And from COVID to coups and from climate crisis to cuts, our solidarity and compassion as a community has been tested. But as our partners from the Gates Foundation, from Action for Global Health, Sai, a fantastic advocate, will all demonstrate, and as we hope the HEAL campaign exemplifies, the spirit of the global health community cannot be stopped or curtailed. So the context within which this sits, we know earlier this year and described as a gut punch to the world's poorest, sadly, the UK government made the decision to reduce its aid commitment to 0.5%. And some of the poorest and most conflict affected areas, many of which we all work within or work with partners in, have had their UK aid programmes cut by more than half. But we're also seeing how the voices of health workers around the world have become amplified in our global fight against COVID. And in the UK alone, the voices of over 1.4 million NHS health workers at the centre of our response to COVID are being heard. So it's within this context that THET's latest campaign has been formed. And in a nutshell, we're going local to support the global. So this campaign will seek to mobilise NHS voices and influence key members of Parliament, those who are sitting on the fence and aren't quite sure which way to slide. We're hoping that we can convince them to become publicly supportive of UK aid investments in global health and hopefully influence their decision making as they look back, hopefully, towards a 0.7% commitment very soon. Over the years at THET, and that's 30, so there've been a number of them, we've learned that narratives centering on mutual benefit and health security have been effective lines as we advocate for these sustained and increased investments. And working alongside supportive MPs from Theo Clark to Alistair Burt to Andrew Mitchell, THET's really focused on using those lines as well as evidence to influence this. And in this vein, we believe that we can move these key individuals, we can influence, we can change their behaviour using these same narratives expressed by those at the centre of the story, health workers. So by working to amplify the voices from across the NHS and globally, we'll demonstrate over and over again the clinical, social and wellbeing benefits that can come from the UK's health sector engaging in global health. So today and moving forward, I hope you will join us as we stand together to heal. So I'm now really pleased to introduce our first implementing partner, Kate Davies, who is the Global Policy and Advocacy Senior Programme Officer for the Bill and Melinda Gates Foundation in the UK, who'll speak to you now about the Decade of Health campaign that they've been running over the past year. Thanks, Kate.
Sorry, just finding my unmute button. Thank you very much, Charlotte. I am going to whiz through many of these slides just to give you a kind of background and intro into the Global Health Initiative, as we were calling it internally, that became known as the Decade of Health campaign that we ran in the UK over the last couple of years. This really started for us in December 2019. Where we were suddenly, I think, faced with the realization that we needed to focus on some non-traditional audiences, that we in our partner community had probably messaged our supporters quite a lot over the past few years, and we were interested really in exploring or experimenting whether or not we could focus on some non-traditional audiences, particularly those who were right-leaning, and design message frames and creative concepts specifically for them without alienating our supporters, and also looking at media buying and investing in a kind of data-driven and strong measurement approach that we could learn some lessons from this over the past couple of years. What we did last year became the Decade of Health. We were very lucky that we had a lot of partners on board who kind of agreed to provide their logos with us so that we could build a kind of online digital platform that allowed people to engage with accessible content, particularly on global health. So nothing that was too kind of left-leaning or too detailed or too off-putting, but we particularly wanted these non-traditional audiences to engage in some content on this platform. And to accommodate a breadth of programs, we were interested in really just kind of educating this audience, giving them some information to engage with. This audience that we had seen in focus groups often was perhaps less supportive, and one of the reasons they usually kind of articulate is that it doesn't seem very transparent. They don't really understand what global health is, or indeed what aid and development does. And so we wanted to provide a platform for those audiences to kind of engage with content, to learn a little bit about what we do, and to see whether or not they were movable on our issues, if they could become more supportive or perhaps take more actions. In 2020, we had a lot of creative assets that really came from the community and from you guys. In fact, you know, lots and lots of health workers sharing their story, lots of people, lots of investments, lots of things that were happening in the UK, particularly through the COVID pandemic, that we were able to educate people on. And some of the best performing content that we saw was content about, you know, the 10 people in the UK who are changing the face of health, the 10 things the UK is doing to make the world healthier. And some of these very just kind of informative and optimistic pieces of content were incredibly effective with these audiences last year, just in terms of engaging them and driving them through to the website where they would look at additional content. It's worth saying that we had quite a big budget to play with in 2020. This was prior to, you know, the budget was allocated prior to the pandemic. And so we had a little bit less this year, which I'll come on to. But we managed to produce a big kind of TV commercial, which we aired during Gogglebox on a Friday night. We had billboards around the country, and we obviously had a very strong digital campaign that was augmented by some radio as well. So what we really saw last year was that this kind of mass visibility of informative and optimistic content really did help this audience kind of engage and at least demonstrate some levels of interest in what we were doing last year. In terms of what we tried then for this year was we were hoping to see, you know, we saw last year that we could make them more aware, we could make them more optimistic and proud of the UK's role in global health by designing content for them and putting it in front of them, crucially. We were interested to see if we could take it a step further this year, if we could move from kind of interest and awareness and potentially mobilise this audience in support of UK leadership on global health. And we particularly wanted to kind of test again around the time of the G7 summit, whether or not we could move this non-traditional right-leaning audience in support of vaccine equity and pandemic preparedness, particularly in the summer of this year. In terms of the change logic, I mean, this is really, you know, to the left here, we're looking at increasing visibility as our kind of indicator zero. We wanted to generate interest. We assumed that they didn't know an awful lot about global health and probably weren't seeing a lot of global health messages. And if they did, they probably weren't designed for them. And so we were interested to see if simply putting global health messages in front of this audience sparked interest, and if that kind of sparked any kind of conversion or any kind of behavior change. And so this year we were interested here in particular in seeing if we could show support, mobilize them digitally so that they, you know, that they showed support to Boris, to the government around the time of the G7 summit. The creative and the targeting that we were looking at this year, it looks as though that is this playing? Just a little piece of creative there that shows you our campaign from this year in particular around the summit. It was all about building a bigger bubble. And so obviously in the UK, we're all very familiar with bubbles. The idea here was that we like the alliterative language, but we also wondered if, you know, building a protective bubble around the world was kind of language that this audience was familiar with, that it was an easy kind of way of demonstrating the value of, you know, vaccine equity and pandemic preparedness. We did the same thing this year that we had done last year, which was we really focused on the innovation, on the research, on the science that was happening in the UK, at the same time as really focusing on the humans, on the voices, so the doctors, the nurses, the frontline health workers, and also the researchers and scientists that are working across our universities as well. And this content we did find was really, really effective in terms of sparking interest and leading audiences through to our platform online. We had about 9 different ads in social environments. We also looked at some Google paid search ads. We had social ads linked to the Decade of Health website, and we also tested a couple of calls to action, specifically because we wanted to mobilize the audience this year, and in particular with this kind of non-traditional audience, we wanted to keep it relatively light touch. And so the calls to action we experimented with were kind of clicking through and signing a pledge that asked the government to make sure that we were, learning the lessons from the pandemic and building a bigger bubble around the world. But we also had a call to action that was really about this user-generated content, which was, we're all looking forward to getting back to normal. We're starting to see the signs of that. If we want to get back to normal, we have to make sure that, the whole world is back to normal. Nobody is safe until we're all safe, but what are you looking forward to? So rather than kind of expecting to mobilize this audience in a particularly political way, we were seeing if we could mobilize them in more of a kind of social media friendly way that really just says, tag us in your photos or holiday photos or whatever you're looking forward to doing again that you haven't been able to do for a while. We also, again, kind of, really focused on the website content because we wanted, once we had audiences click through from the social ads, we really wanted them to engage in the website and learn even more about what was happening, learn more about the health workers, learn more about science and innovation and doctors and researchers, and trying to make global health here in the UK much more tangible to these audiences who perhaps aren't normally used to understanding what global health is. And we also engaged 4 quite niche influencers that we thought were particularly salient among these right-leaning audiences so that we could kind of help drive some social norms to really encourage the user-generated content and to encourage the mobilization that we were hoping to see. In terms of the kind of phasing, we had to, we were, again, per our change logic, we were driving visibility in the first instance, reach visibility. We wanted to make sure that this content was seen so that we could measure whether or not this content encouraged people to feel more proud, more optimistic, and to be more interested in the work that you guys are all doing in support of global health. And then also, the third phase there is really to activate those audiences around the G7 summit. In terms of what we found, this year we reached nearly 9 million people, which was quite a lot. We reached about 20% of our right-leaning family audience at least 5 times. One of the things we learned last year was that we really do need to reach these audiences again and again in order to gain any kind of traction. I've included the figures there from last year just so you can see the kind of differential really we were looking at with the budget, where last year we reached about 46 million, and I think it was over 95% of our right-leaning family audience was reached at least 5 times in 2020. But what we did find in the public opinion polling was that 1 in 5 of the adult British public did recall the Decade of Health brand and the Build a Bigger Bubble brand, which we were surprised at. Last year we had seen about 1 in 4, so 25% of the public recalled the brand. This year we were expecting it to be a lot lower, especially Build a Bigger Bubble since it was a new brand, but we saw about 1 in 5 this showed up in public opinion polling, which was really impressive for us in terms of reach. In terms of interest, we saw nearly 3 million expressions of interest, and this is things like click-throughs, likes, interactions, video views to completion, especially when you're looking at a kind of pre-roll ad setting. Again, in the polling with the red at the bottom there, we did find that those who recalled the brands were 11% more optimistic that we would vaccinate the world against COVID-19. So we measured a few kind of global health sentiment questions here that we were looking to see, of those who recalled the brand, did they differ attitudinally or in terms of their perceptions from the broader public? And yes, they did. They were much more optimistic that we would at some point vaccinate the world. In terms of support then, what we were looking at here were really some of the more behavioural movements or the signs of kind of active support that we were hoping to see in terms of mobilising them around the G7. To be frank, we didn't see a huge amount. I mean, we saw about 3,000 signs of public support there, which we saw similar levels last year. So to some degree, we have become more efficient. From a lower spend, we are able to convert more reach figures into interest figures and into support figures. So we are a little bit more efficient, probably because of some of the brand equity that we built up last year. But we really didn't see, as you can see there, the user-generated content was 3. The pledge signatures were 75. It really wasn't what we were hoping to see. But in terms of this being an experiment, I think for us the lesson to learn here was that this audience just isn't yet movable or activatable, I should say, on our issues, but it's certainly not because they're not interested. And that's one of the things that we really learned from the click-throughs, from the view-throughs, from the engagement with the website, was that this non-traditional audience, who we don't tend to think engages with our issues, was actually very, very interested in learning more about the work that you guys do, learn more about the work of the academics around the country, and understand a bit more about what global health actually is, even if they weren't activatable and even if they weren't yet ready to show up publicly in their social media platforms. What we did find again in the polling, though, was that those who recalled the brand versus those who didn't were actually 6% more likely to say low-income country vaccination was critical versus high. And this was something that for us was really quite striking as well. I think throughout this phase, or throughout our testing of the Decade of Health, one of the things that's really struck us are these perception change metrics that we're seeing. This audience, being a right-leaning audience, usually performs less well than the national average on these kinds of questions. You've usually got kind of left-leaning or Labour voters who will perform a little bit higher than the national average, and Conservative voters or right-leaning voters who perform a little bit lower on our issues in particular. But here, as you can see, we were targeting a right-leaning audience. These audience were a little bit more right-leaning, a little bit lower educated, a little bit more kind of regionally focused as opposed to, kind of London-centric. And yet we saw that they were better on our issues than the national average, which for us is a very compelling finding, and kind of underlines for us that this is actually a very important audience that is interested, is engaged, even if they're not yet taking action. I'm going to leave on these kinds of learning slides here. If anyone has any questions, I'd be really happy to take them. I think for us, we're unclear yet kind of what we're going to be doing with this going forward, but obviously, as Charlotte said, given the kind of 0.7 to 0.5, given what we're looking at in the UK, this does feel still to us as though it's a significant audience, and one that is worth at least educating and engaging on some of these issues. But really that learning that the right-leaning families are apparently unwilling so far to take visible actions, we could see how long it takes to kind of move them along the change, the stages of change logic. But we did find a few other really interesting points in here, like over 50s Conservative publication readers were actually very engaged and very visible. And so we learned a little bit more about other target audiences. So I will stop there. And if anyone has any thoughts or questions, I'd love to hear them.
Thanks so much, Kate. Thank you. I'm actually going to dive into Sai, and then I'm going to come back, Kate, if that's okay, to questions after Sai and Katie have presented as well, because I think that Sai hopefully will add a fantastic kind of personal view now onto the work that Kate has just spoken to. So I'm really pleased to be joined by Sai. He's the director of the British International Doctors Association student wing, but he's far more than that. And as you'll see, he's an active advocate and campaigner and global health enthusiast. So thanks, Sai, for joining us, and over to you.
Yeah, sorry, I was muted. But thank you, Charlotte, for that wonderful introduction. So my name is Sai Pilariseti. I'm a medical student, currently in the northwest of England. And yeah, today I'm just going to be talking a bit about, who I am, how I got involved with global health, and secondly, my experiences during the Health Legends campaign, which we ran earlier this year. 1 second. Yeah, so I come from India. I grew up there, and then in a place called Hyderabad, which is in the south of India. I came to the UK to pursue a career in medicine. So I'm currently a medical student, as I said. I really got involved with global health after I finished high school, after my A-levels. I decided to take a gap year. And then during that year, I worked with a breast cancer charity in Hyderabad. And then I helped create a breast cancer app, basically. And it was South Asia's first app and the world's first app in so many languages. And for those of you who know India, you'll know that India is quite a big country. And there's quite a lot of languages that are spoken across the country. So there's around 12 major regional languages. And we've been able to create this app in all 12 of those languages. So this way that women, even in rural India, even if, they don't know English, they get access to accurate information about breast cancer and even other breast health issues. And the main purpose was just to reassure the worried well and to ensure that people were getting accurate information. So, global health, I think, addresses many different aspects, but some of the main ones are education and trying to create awareness. And this app kind of covers both of those things, because I think breast cancer is still, quite a taboo issue in India, especially. people don't want to talk about it. It's quite, it's hushed up. And this actually, brings awareness to actually that it is a very important thing to be talking about. It is the most common cancer affecting women in the world and in India. And it's something that needs to be openly spoken about. And just on the top, you'll see me with a gentleman called Mr. Amitabh Bachchan, who's one of the most popular Indian actors. So when he launched the app, it was great to have him launch the app, because then it kind of creates a publicity, that awareness that is so important in global health campaigns. Moving on to the Health Legends campaign. So we started this campaign, I think it was last November. And it's been an amazing experience. We launched the website, followed by the social media. And what the entire idea about the Health Legends campaign was, it was to highlight, the work that different healthcare workers are doing across the world. So I think the campaign chose 5 members in the UK, and it was 5 members across the world. So Papua New Guinea and loads of different countries, and they kind of linked the stories together. And together, I think we hopefully we made an impact and created a bit more awareness about the importance of global health, why it needs to be talked about more and addressed more. Just to go through the campaign was a massive success. I mean, as you can see with the billboards and the different organizations like NHS trusts picking up on our campaign, advertising, promoting it. I had the privilege of speaking at multiple primary schools, secondary schools, talking to the kids about global health, about career in medicine. It was a fantastic experience. On the left, you can see we even got the campaign spread all the way to India. Dr. Tamilisai is actually the governor of our state, so she's at the level of like a cabinet minister, and she recognized the campaign. She saw it on social media, and she replied to it as well, which was a fantastic. I think that's towards the end as well. And I was able to write blogs. I think all my other colleagues as well, they wrote blogs, spoke at schools, very similar things. And I think all of these things, when you put them together, they really show what we can do together as a team. And I think we've had some fantastic support from the Bill and Melinda Gates Foundation and from everyone else involved. And it was a really good experience. I'm not sure what else to say. If you have any questions, I think Charlotte said we've keep them to the end, but thank you.
Thanks so much, Sai. Thank you for sharing your experience there. And as Sai noted, that's sort of the more local aspect of the campaign that Kate was speaking to. So it's fantastic to see how that played through into local communities as well. So our final implementing partner this afternoon is Katie Husselby, who is the director of the Action for Global Health organisation. I know many of you are really familiar with her and the team there, so I'm delighted that she's able to join us fresh off of annual leave. So we've pulled her in quickly to join us this afternoon. So I'm going to hand over to Katie to talk through the Healthy Futures campaign, which again is part of this broader campaigning space that we're seeing at the moment. Thanks, Katie.
Fantastic. Thanks, Charlotte, so much for that introduction, and good afternoon to everyone on the call. As Charlotte said, I'm the coordinator at Action for Global Health, which is a network of organisations, as you can see from the logos on the screen. We're a group of organisations working towards the achievement of universal health coverage globally, and our wonderful hosts today, THET, are one of the members of our network. As a network, we really believe that the UK government has a really important role to play in global health and in improving global health outcomes around the world. And so we advocate for the UK government to provide strong political, financial and programmatic commitments to global health. And I think, as the other speakers have sort of mentioned and gestured towards, over the past couple of years, we were also conscious of the waning public support, sort of plateauing funding for global health. And so we strategized with our members and agreed on the need to sort of build a movement of public supporters willing to take action and campaign around the UK's role in global health. We wanted our campaign and our efforts to be sort of complementary to other campaigns that were going on, like the Decade of Health and Health Legends campaigns. And we also really wanted to utilise the existing reach of many of our member organisations, some of which have kind of campaign aspects to their organisations. So we really decided to focus on a slightly different target audience, so focusing on public audiences who were maybe had some awareness of global health issues, maybe were interested, maybe sought information about global health or international development, and then to really try to convert that into action and support and sort of mobilising actions to support the UK's role in global health. So, just trying to get onto the next slide. So in terms of what we wanted our audiences to think and do, as I've said, we wanted to build up their understanding of what global health is and why it matters. We wanted to make the connection between global health and universal health coverage. So global health being about the universal availability and affordability of healthcare. We also really wanted our campaign to highlight the interconnections between health and other issues. In particular, we've been doing quite a lot of work around health and climate change. So we really wanted this campaign to be able to be an umbrella to take into account other issues as well. And crucially, as I said, we want those audiences to support and be willing to take action around the UK's role in global health. So in November of 2020, we launched the Healthy Futures campaign, which was supported by more than 20 of our member organisations. In terms of the identity, as you'll see from this slide, we really wanted to create something quite visionary. We wanted to try and reach outside some of the traditional sector audiences and hopefully engage and inspire some new supporters to join this campaign and join the Healthy Futures movement. As you'll see, the kind of the neon artwork on the screen kind of builds into Technicolor images. So we really wanted to show how health systems could be transitioned from something imagined to someone's reality. And so really illustrating that change that we wanted to see in the world through the imagery. In terms of then sort of what the campaign looked like and what we did, we built a supporter platform website which outlined the vision of the campaign and provided more information and case studies from our members of sort of health programs on the ground that were funded and supported by UK Aid. We also have been running social media and digital campaigns as well. We also did webinars and tried to activate particular groups. In particular, we've had quite a strong focus on activating youth groups on global health, particularly working closely with Students for Global Health, who are a student network of medical students up and down the country interested in global health issues. And also supporter mobilisation. So far we've had 2 campaign actions that we've taken. Last year, we mobilised our supporters to write to the Foreign Secretary in the lead up to Universal Health Coverage Day last December. And then more recently, we got our supporters to write to their local MPs to ensure that global health and universal health coverage was a priority at the G7 summit back in June. I think we're quite tight on time, so I'm not going to go into too much detail on the results. But we were really pleased to see the way in which the campaign had both significant reach, but also was then able to mobilise more than 50 supporters to write to their local MPs and engage 50 MPs through the most recent campaign. And later this year, we're going to be launching the next action within the Healthy Futures campaign, which is going to be focused on climate change and global health in the lead up to the Climate Change Conference, or COP26, in November. We've been really excited by all of the engagement of campaigners so far. Given COVID, it's been a very different time from what we originally anticipated when we were planning from the campaign. And I think it's been great to kind of build on some of the increased understanding in the general public around the global health and why it's relevant to people in the UK. And I really just wanted to end by sort of mentioning and referencing the support that we've had from NHS and health workers in our campaigns as well. We've had sort of multiple media pieces bringing to light the voice of NHS and health workers around the world. We've done campaigns around International Nurses Day. And as I mentioned, we've worked particularly closely with Students for Global Health and medical students up and down the country who've been able to bring a huge amount of energy and credibility and really trusted voices within the Healthy Futures campaign. I think I'll end there. So thanks again to THET for this opportunity to present about Healthy Futures, and also very happy to take questions.
Thanks so much, Katie. Thank you. And I know that THET have hopefully rallied behind the Healthy Futures campaign, which we feel is really crucial and of course is a key part as well to reaching out into another audience that we're all trying to work towards influencing and creating that positive change within. We've got a couple of minutes now, so I just wondered if anybody had any questions or thoughts for Katie or Sai before we move on to talking through some of THET's campaign work that's coming up in the next couple of months. So do either unmute yourselves or pop a question in the chat and we can read through that. And if not, there'll be a moment later as well if we don't have anything at the moment. Oh, there we go. Ben. A question from Ben to Katie. Was Action for Global Health targeting particular kinds of MPs or generally was it by political affiliation or geography?
Thanks, Ben, for the question. It's sort of been dependent on the campaign. So for, as I mentioned, for Universal Health Coverage Day last year, we actually decided to go for the Foreign Secretary directly rather than particular MPs because we really wanted to engage him at that kind of ministerial level on global health issues. And then more recently for the G7 summit, we decided that we actually wanted to go for quite a broad remit of MPs to try and influence the G7 summit and global health and universal health coverage being prioritised. I think it's also worth saying we're quite early days in terms of the campaign journey, so we were really interested to see what particular geographies and constituencies we managed to engage campaigners in because we're quite early in the development of this campaign. But yes, it's been sort of dependent on the particular kind of target audience for each campaign, but most recently quite broad.
Thanks, Katie. And Kate, I'm not sure if you spotted that, but
I did. I'm not sure from our organisation I'm the best person to answer the question. Andrew Mace tends to lead our UK kind of advocacy and government work in the UK. I think the Gates view at the moment, we're kind of strategizing a little bit on what we can do in the UK, particularly to support a lot of the other efforts that are happening on the ground to kind of influence public support in that area. And, you know, I don't think that we necessarily have a particularly optimistic view, at least with the current government. And so I think we're working, you know, with our teams in Seattle with the additional budget that we know we've had come through from our co-chairs and deciding, you know, what we can do with that in the UK to kind of support some of this. And also, as many of you may know, kind of stepping in where we can programmatically to cover some of these. So I think to answer it pretty broadly, you know, I don't think we think the direction of travel with UK aid is particularly good as it stands. And so that's, I think, why, to your question, Ben, you know, we are focusing a little bit more on these right-leaning audiences. We are hoping, I think it's fair to say that even prior to the aid cuts, we had hypothesized, and I know a lot of partners had as well, that, you know, we are preaching to the choir often with a lot of the communication, advocacy communication that we do. And then on the other hand, the other way that global health or aid kind of shows up to public audiences is largely through the hands of fundraising communication, which obviously articulates need. And so I think we recognize that as an organization, we are potentially almost uniquely placed to be able to kind of support some of this work that where we're not relying on kind of, you know, we're not incentivized to get fundraising, we're not, you know, incentivized to go after the kind of easier audiences. And so I think we see ourselves as a bit of a support there in terms of how we can kind of grow the general pie, if you like, of support for global health spending. And we think that can best be done, I think, through kind of educating and engaging these audiences that are perhaps on the fence. They're not opposed to aid, but, you know, there's a huge public opinion, as we know, is a kind of bell curve. And so you've got the vocal kind of left-leaning supporters who are obviously pretty outraged at what's happening and are doing the best they can. And then you've got those more vocal supporters on the right who are pretty satisfied with this. But from the polling and the insight that we've been doing, there is a huge chunk of people in the middle who don't have much of a view, but who are potential kind of supporters of our issues if we speak to them and engage them in the right way. And so I think that's where a lot of our strategies now are coming from, and where they're hopefully going to be leading to.
Thank you, Kate. And actually, Sai, I did had a question, I suppose, leading on from that. I know that your work with the Gates Foundation and with the Health Legends campaign was around sort of local engagement and MP response as well. And I just wondered if you had any reflections on how you felt that had been from your personal perspective, and if you had any words of advice as well for how we as organisations can support others to go about doing that, or as individuals people might feel that they can take that forward.
Yeah, so out of the 5 of us, I was one of the unlucky ones. Who didn't get really a response from the MP, because I think at that time it was the second wave had just hit, and they were really busy with things in their own constituencies. But I think, was it Dominic Robb, I think, who actually retweeted my colleague's a tweet about the health insurance. That was fantastic. I received an email, I think 3 months later, from my MP saying, I'm so sorry we missed this, but please let us know if we can help. So I think they are interested in helping, and I think it's just, writing emails. Also, a school which I spoke at actually has really good links with the local MP, especially I think secondary schools. So I think that would be a really great avenue to explore, because I think they would be the best people to help approach the MPs directly without waiting, months for them for their office to reply. So yeah, I think that would be a great way to go about it.
Thank you, Sai. That's fantastic. And I think Casey, along with TAF at Students for Global Health and Chaitra, are looking down those avenues as well. But that's fantastic advice. And we all know how difficult it is to reach into and get the attention of MPs, particularly at the moment. So any advice and experience is always useful to hear from. So thank you so much to all of you for that. I'm going to hand over to my colleague Michelle now, who's going to talk through some of the data that's behind our HEAL campaign and the initiative that we've launched. Thanks, Michelle.
Hi everyone, so my name is Michelle and I am the Campaigns and Outreach Officer at THET. So I'm just going to quickly run through the research that we conducted with Ipsos Mori, and we conducted this research just to better understand the attitudes and perceptions to global health that the NHS workforce had. So there was a total number of 400 NHS health workers that were surveyed, and we made sure that this sample size is representative of the nationalities, locations, and different cadres within the NHS. So the first thing that we found was that there are already pre-existing high levels of engagement within the NHS. So 62% of respondents has actively participated in global health activities, and this can range from volunteering in an emergency response to academic research. For 41% of these respondents, motivations were rooted in altruism and solidarity. So quite a few respondents stated that they wanted to help those in need, or they wanted to support their colleagues overseas. So the second thing that we found was that 50% of respondents wanted to hear about global health from their fellow health workers, and this can take place in multiple ways. So for example, through social media or through sharing and learning events. We also found that 69% of respondents were unsure about their MP's views on global health, and we thought that it was necessary to probe this because one of the campaign's main objectives is to influence MP's stance on global health and UK spending. Finally, we thought that it would be necessary to understand the perceived barriers to engagement in global health within the NHS. So the first thing that we found is that the global pandemic has obviously had quite an impact on people's opinions of global health. So for example, we found that 43% of respondents believe that the government is either spending the right amount on UK aid or should spend less. And I have to note that this was done before the cuts to UK aid were implemented. Sorry. And finally, we found that quite a few respondents stated that they wanted greater support from the NHS in order to get involved with global health. So there were worries around job retention, lack of opportunities, family obligations, and things such as that. So that was a very, very quick snapshot of the research, but you can find the link to the comprehensive research summary in the chat box. What I'm now going to ask is, do these findings represent you? Are you surprised by the data? And a poll should, okay. Yeah, so if if they do represent you or they don't. I would really like to hear your reflections and opinions within the chat box. Sorry, I just saw Ben's question. So 41% of the NHS staff were motivated to be involved in global health through altruism and solidarity. What was the motivation of the 59%? So it varied. So it was things such as like personal development or professional development. Yes, as I said, Summer will, there's like a more comprehensive research summary. But yeah, there were just so many reasons for people's motivations to get involved with global health. So within this campaign, and as well as working with you as a community, we're also working with leaders in the NHS, such as Health Education England and the NHS Confederation Conference. The NHS Confederation to kind of address the findings that were brought up in this research. And we're also excited to be working with Health Education England later on in the year to do more research surrounding these attitudes and perceptions to global health within the NHS workforce. So thank you so much for listening and engaging with this. If there are any other questions, please just put them in the chat box. And if not, I will just hand over to my colleague, Summer.
Thank you, Michelle. So hi everyone, I'm Summer and I'm the communications coordinator at THET, and I'm excited to introduce you all to our HEAL campaign. So the campaign is both a reflection of THET's long-term commitment to building stronger health systems in low and middle income countries, as well as a response to the weakening of support for this work that we're currently witnessing, most clearly through the shrinking of the aid budget. The campaign builds on the fantastic work of the Bill and Melinda Gates Foundation and Action for Global Health that we've heard about already in this session. And it really is inspired by the tireless commitment of the NHS to support colleagues and partners overseas. So why HEAL now? Why have we launched our campaign during one of the most challenging periods the global health community has faced collectively? The pandemic has really placed a spotlight on health inequities within and between countries. For example, half of the world's population cannot access essential health services. Almost 100 million people are pushed into extreme poverty every year paying for health expenses. The top 20 countries with the lowest life expectancy worldwide are in Africa. And of the 3.65 billion COVID-19 vaccines administered globally, just 0.3% have been in low-income countries. And it's against this backdrop that the British government has cut the aid budget by £4 billion. And as we've heard already, the damages caused by these cuts are, on the world's most vulnerable, cannot be understated. And we believe that we must respond together, and this campaign really provides us with the platform to do just that. So if we move on to the next slide, I'll just explain some of the steps that we've taken so far to build our campaign. So building on the research process that Michelle outlined, we began to draw on the findings and develop our advocacy campaign. So insights from interviews with NHS professionals, such as respondents making repeated references to inequality in access to and quality of care, coupled with key findings from the quantitative research, such as 94% of respondents agreeing that health is central to human development and poverty reduction. And these were really integral to this process and really informed the direction of the campaign. So as you'll know by now, the campaign is named HEAL, which stands for Health Equity for All, and through messages which focus on the theme of solidarity, such as it's time to heal, together we can make it happen, and without health workers we cannot heal. We're aiming to convey the significance and urgency of health equity, particularly in the wake of COVID-19. So by exploring the concept of healing, we're also inviting those who participate in the campaign to reflect on what they're doing personally as well as professionally to help heal themselves, their community, and the health systems around the world. So when we first began working on this campaign back in 2019, we could never have imagined the crisis that has come to grip the world for the last year and a half, let alone the adversities that health workers across the world continue to face. So recognising how challenging this time has been, as well as the mounting asks that are being placed on health workers, two priorities became really clear for this campaign. One being that it has to be positive, and two, that it has to be impactful. The pandemic has really highlighted how powerful partnership is, and the incredible strides made within the health community have only been achieved through solidarity, collaboration, and investments in health and care workers. And it is this power that we are aiming to capture through HEAL. So in terms of how the campaign looks, you may have seen some of our graphics and videos on social media, and you can probably tell by our very colourful PowerPoint presentation that HEAL has a very bright and fresh feel that reflects the campaign's positive identity. And you may also have noticed that the image features a lineup of health workers from across the world. Now, these individuals have all been involved in THET's work at various points, and they represent a very small portion of the incredible health partnership community that we have the pleasure of working with. Each of them has deliberately been cut out of their original photo to remove any form of background or context. And the aim of this is to illustrate the key campaign concept of solidarity between health workers, wherever they are in the world, focusing on the similarities that unite us across borders. So on to the next slide. What are we hoping to achieve and how? So by platforming the voices and experience of health workers in the UK as well as in low and middle income countries, we hope to increase support for UK aid investments in global health. And throughout the campaign period, we will be launching calls to action on a regular basis. These will be announced through our social media, newsletter, and at upcoming events. And each of these calls to action aim to enable you to add your voice in defence of UK aid. So from engaging with your MP to sharing why UK aid matters to you, we want this campaign to be driven by our community, with HEAL providing the space to share the stories that you want to tell. So to support this, we've launched our brand new campaign hub, which we'll put a link to in the chat. It's just housed within THET's existing website, and it contains the necessary information to support you to take action. So there's an introduction to HEAL, some key facts and figures on health and equity, as well as some of the insights drawn from the Ipsos research that Michelle touched on. We have some video messages from existing campaign spokespeople and information on our key partners that we've introduced you to in this webinar. In terms of next steps, we are going to be producing a campaign toolkit targeted at health advocates, NHS trusts, and the wider health partnership community. This will have all the necessary information and advice to effectively engage with local media, to communicate with decision makers and advocate for increased support for NHS engagement in global health. So stay tuned for that. As we're coming to the end of the webinar, we're excited to launch our next 3 calls to action. So we invite you to share our latest campaign tweet. So if you click on the link in the chat, it should be coming up soon, you'll be able to share a pre-written tweet. Secondly, if you're based in the UK and you're interested in writing to your MP, then we can support you to do that. So we've created a Google form where we can collect your details, and we'll share some guidance on how to do this effectively. And lastly, you can submit your story to our Time to Heal series. So a bit more about this. We are looking for stories from health professionals that illustrate the benefits of working together to build stronger health systems across the world. So these stories could talk about particular global health projects that you've been involved in and what's been achieved, how the UK's NHS benefits from working in partnership to strengthen health systems overseas, or what COVID-19 has taught us about the power of solidarity. We welcome stories in a variety of different formats, so it can be something that you've written, images or video, and all of the eligible submissions will also receive a 20% discount on tickets to our THET conference, which is coming up at the start of October. So these stories will really form the basis of our campaign, and will be disseminated through our social media and website. And as I said before, we really want the campaign to be driven by the stories that our audience want to share. So we'll put a link in the chat to that as well, and you can familiarise yourself with that, and also feel free to share this opportunity with your networks. So thank you all for listening. We have around 10 minutes left. If we have any other questions, feel free to raise your hand or put a question in the chat. And we'll also share a link to our Twitter poll where you can tell us how you're going to be taking action.
Fantastic. Thank you so much, Summer and Michelle, for diving into that. And hopefully that's given everybody the background context specifically to the HEAL campaign. So, you know, unlike the work of Kate and Casey and Sai, we're really focused on reaching NHS health workers and hearing from you about your experiences and why global engagement is so important to you. Not least because obviously we want to make sure that that UK aid investment in global health is uplifted again and is at least sustained as we move forward, and we really feel that your experiences are key to doing this. Ben in the chat has asked, just centering back around that Ipsos Mori research and the Gates campaign more broadly. Of course, all of these were done pre-COVID and in the midst of COVID for some of them. So our Ipsos Mori research actually took place in October and November of last year, so almost right in the midst of COVID, of the pandemic. And I think this led us to really reflect on whether the results that we'd received were due to COVID or whether they were due to general attitudes that were sort of more broadly seen across the NHS. That certainly led us, I think, to do more investigations. So beyond the quantitative research, we undertook a second stage of qualitative research. And that led us to talk more in depth to some of those respondents about some of, you know, the feelings towards UK aid and more broadly towards a campaign in global health. And we were really bolstered by the fact that actually there was a huge positive kind of upswelling of support for a campaign focused on this, not least, I think, for personal reasons, for, as Michelle said, that altruistic side and the solidarity aspects of it, but also for the huge benefits that THET know all too well that are involved in global health engagement and in people being allowed to spend that time with one another overseas or virtually, learning from one another. So I think it would be different now. I think, you know, we're now almost a year on from that first piece of research, and I'd be interested to see what Kate and Casey thought too. But you know, I think those results would be different. I don't think they would show any less support though, and almost now I feel like there feels like such an upswelling of support for global health more broadly and for UK aid. I think even within the broader sector and the research that's taking place within perhaps those right-leaning communities across England in particular, and you know that there's support there for UK aid investment and support for a Britain that is globally focused. And that means, you know, for aid considerations as well as others. So I think we'd be seeing the same things, I hope. But of course, our next round of research, which will take place in September, October of this year, will give us a greater understanding of whether we're right or wrong. And hopefully it'll prove us right. But I'll get back to everybody on that. I don't know if Casey would have anything to come in on that as well.
Yeah, I mean, our Decade of Health campaign kind of we started thinking about it pre-COVID, but we launched during COVID. And we did actually think that we had a bit of an extra opportunity with COVID, because I think people, you know, where we saw a lot of interest and engagement from these non-traditional audiences, it was at a time that, you know, everybody was interested in global health and in trying to understand more about the COVID pandemic and understand more about, you know, the kind of prognosis for us as a country and for us as individuals. So we certainly, I think, kind of hypothesized that we had greater engagement because of COVID and some of these changes. And so, like Charlotte, I think we'll be interested moving forward to kind of see if that is sustained. But I do certainly agree with Charlotte's analysis that actually, you know, this has caused people, I think, to recognize that there is a greater connectivity around the world about health in the UK and health overseas being fundamentally connected. In the polling that we've been doing, and we've been surveying the British public approximately kind of quarterly since the pandemic hit, but also we've been surveying on aid, attitudes to aid more broadly and in the longer term, as have the Development Engagement Lab, who runs from the University College London. We both found this year, earlier this year, that there was a huge jump in support for aid expenditure, about 10 percentage points. And we think that this was likely because of the conversation and because of a lot of the news coming out about the aid cuts. And so that one, again, I'm not sure how kind of sustained and long term that shift in perspective would be. And it was mostly coming from the left, but there were certainly some of the right-leaning audiences in there that did shift perceptions. And we've certainly seen throughout the polling that we've been doing over the past year that there is definitely an indication that people are recognizing the link between aid expenditure, global health, and positive future outcomes. Apologies for going dark. I've got light shining in on me, but yeah, sorry.
Thanks, Kate. Katie?
Yeah, I completely agree with you both, Charlotte and Kate. And I think in another way, it's important to think about the way that the COVID pandemic has also elevated the role of health workers and sort of how they're trusted. I think another set of research recently done by Development Engagement Lab, who you also mentioned, Kate, also found that health workers were the most trusted voices in society. And I think we've seen a huge increase in support for the role of frontline workers, and we've certainly seen that personally in terms of just the uptick of interest from journalists in speaking to health workers as part of our campaigns as well. So I think that's also really, really important in the context of this campaign, and really exciting to have health workers really at the centre and leading this campaign too.
Thank you, Katie. Fantastic. Well, we're nearing the end of the webinar now, and I'm just really grateful to all of you for joining us, and particularly to Kate, Sai, Casey, Michelle and Summer, all for speaking this afternoon. I hope that that's been informative. I hope that that makes you want to join us in healing together. And we're really looking forward to sharing the results as we progress, and hopefully bringing back Casey and Kate and Sai for more insights on their work in the campaigning field as well. But please do reach out following this webinar if you have any thoughts or questions for us, or any further ideas about how we can promote the work of these campaigns and reach those core MPs and start influencing their attitudes and behaviour. So all I have to say is thank you so much. We'll be sharing the webinar and all of the materials following this as well. And I know that a number of people weren't able to join us this afternoon, so our recording will go out as well. So for all of those who'd like to watch yourselves back, that will be available too in the coming days. Thank you so much, everyone. Take care and speak soon. Bye-bye.